Okay, now you're the presenter, and now you should be able to upload your presentation or to do it with a screen share. Just as you like.
Okay. Great to see you.
Thank you.
Okay, Ingrid and Fiorella, you will talk about outpatient follow-up and home care of patients with suspected or confirmed COVID-19, and I think this is really a burning topic at the moment, and I'm really looking forward to hear your presentation. Go ahead.
Okay. We will start. Do you hear me? Okay. Can you listen to me?
Yeah, we can hear you. Wonderful.
Okay. Okay. Okay, we are presenting first. Thank you all for inviting us.
Ingrid,
Yes.
a lo mejor es más fácil si suben directamente, en vez de compartir la pantalla, subirle el PDF.
Yes, but I want to show the system working, but I can do it later.
Sorry about that. I thought that you were going to show just the PDF. Perfect. Sorry.
Okay. I can't see you, so I'm talking blind. Okay. First, thank you all for inviting us. We are talking about a module and an implementation of outpatient follow-up and home care of patients suspected or confirmed COVID-19. My name is Ingrid Cesotti. Maybe you know me. I am a bioengineer, work at the Diamante municipality, and also I'm part of the team from the engineering faculty at the Universidad Nacional de Entre Ríos. Comes presenting early, so we work together. Now Fiorella is going to present herself.
Hi, I am Fiorella de la Lama. I am medical emergency technician and work at the Santos Hospital. And at the moment I'm working at the epidemiological node of the demand. The presentation will start with the activities that we have been doing during the pandemic. I started reading and implementation.
Fiorella, sorry to interrupt you. Can you maybe use a headset or something like that? It's a horrible echo. Difficult to understand.
Yes.
I am the problem.
Okay. I started reaching and implementation biosecurity protocols at different states, contact tracing and follow-up of suspected and confirmed COVID-19 patients. The security protocols, institutional protocols, healthcare, hospital and primary health care centers, triage, PPE, contact tracing, pathological waste of hospitals, foley, firefighters, assistance centers, funeral homes and cemeteries, collection and cleaning staff, clubs, gyms, sports institutions, recreational activities, football, hockey, others, geriatrics, closed institutions, for example, penitentiary, merchants, companies, quarries, and domiciliary protocols. The triage is method of identification patients associated with COVID-19 symptoms. Implementation of triage first at institutional level, for example, San Jose Hospital, and the local and departmental level. Definition of cases according to epidemiological dynamics. Identification, travelers, contacts of confirmed case, family members, friends, work activity, doctor, nurses, MT workers. PPE, UCS of PPE according to TASE interventions and or assistance to confirmed and suspected COVID patients, mop caps, gloves, camisole or overall, surgical or N95 mask, boots, face mask or gloves, implementation, optimization of recursos to the economic impact. We have to use it for sets for PPE, yes, suspected patients during the hospitalization every day. Tracing.
Sorry, but we are next to each other. Okay. Contact tracing. We began working with people who return places with community circulation, who remain. If symptoms were detected, the suspected cases were admitted to the San Jose Hospital to perform nasopharyngeal swab. This study could confirm if the diagnosis of COVID is or rule out the suspicion. Symptoms associated with hepatitis and typical symptoms such as anosmia and dysgeusia. The biosecurity. Here you can see people on their daily tasks like ambulance drivers, people admission, the pills they use when they are treating or in contact with a COVID suspected patient. Fiorella and the team of hospital train the drivers and the nurses and the team staff and about how to use it, how to discard them, and also how to care of them. Epidemiological training. Fiorella and the team of the hospital was trained for the epidemiological note in the identification of a probable or confirmed case and its contacts. Also, there were some different types of transmission, community, also about the outbreak controls according to the epidemiological situation, the triage, the tracing, the home care-based monitoring or hospitalization, the hospitalization notification, the discharges, and the death. Okay? The isolation home or suspected case contact. Home isolation with symptomatic patients. And in most of the cases, the period is about 14 days. We also monitor them. We do a monitoring for clinical and symptoms and the clinical evolution of the contacts. The signs and symptoms, also the sequels, the complications according to age groups. So we take care especially about the patients that have risk factors and also the pharmacodynamics related to the COVID studies. The characteristics of the and the new evidence is registered and published by the local emergency team. It means that according to the situation in the city, the recommendations are changing. So when we started at March, some were the recommendations were someone, now there are others. So this disease particularly is changing every day. So we are always changing the strategies and we are redirecting the resources and the planning according to this evidence. These are some of the trainings and the things that we do. Sample people at their houses take us a photo of their saturation, for example, the heart rate, and send that to us. We do on the monitoring clinical evaluation of signs and symptoms. If we detect, for example, in this case that the patient has a 82% saturation, we call hospital and we ask for an ambulance to take that person at home. So we are continuing monitoring these people. There are two suspected case definitions. We can see here, for example, that the ones that meet clinical and epidemiological. For example, when people have fever, cough, and also, for example, myalgia, sore throat, and also, for example, myalgia, sore throat, and other symptoms are clinical. Also, when we have an epidemiological criteria, for example, residing or working in areas with risk of transmission, residing on a travel or travel to an institution. And the other three are patients that have severe acute respiratory illness, pneumonia, and also that kind of thing. So there are our two suspected cases or types of areas that match. So as long as the pandemic was developing, we presented a project system to run this epidemic and another epidemics, because this is for another kind of diseases also. So we presented probability of the Amante and the Oro Verde were availing this project from the University of Mary faculty. So this is a workflow about how we detect a suspected case, and then we indicate, for example, home isolation. Then we do the test at the laboratory. We can have two outcomes, for example. We can confirm the case, so that person has to continue at isolation, and we monitor that patient for 14 days every day. And then we see if the case is discarded. For example, there are two options. We have the persons that have the signs and symptoms but has no nexus, so they don't have a contact with another with symptoms, and also persons that have nexus or contact with the suspected or confirmed case. So that persons are at home isolation too, and we monitor them as well. So in the case of a suspected case, we complete a form that we upload in another system called CISA, that is Argentinian information system, integrated information system. The COVID, for example, is a notifiable disease that is required to inform, so we have to perform a form and then upload it to another software. So the thing that we want to do is to integrate these things in one system. For example, here we have the records that we use on paper, or that were used because they now not using them. The records that we have to on paper. Here you have the name, the ID number, the phone number, where the person is doing the isolation, and the contacts and the names of the family. In the other sheet, we can see the signs and symptoms, for example, fever, cough, sore throat, and other ones. So we do it daily, and we all people, monitoring these people, write down the values on these papers. What we propose is to reduce this variation. So we think that when the people come to our health center, we have notified this disease, however, to CISA, that like I said, but to monitor and evaluate this person and his contacts or its contacts. So that we want to do is to integrate the CISA form that we upload in another system. The proposal is to integrate them, so we can upload or register this on the health system, do the notification from this disease via web service, and then we have all the rest in our system, and we can share this information with the National Health Surveillance System. New Health has already got a monitoring health condition module, so we studied the module and then we do some extensions. Here are the forms. These are the notifiable disease forms from Argentina. These are records that we do on paper. So we included them on our system, yes, on the new health system. With all this that we can do, or we can share reports, like, for example, certifications, also geolocalization of people that are isolated, we can notification, automatic notification, and we can share and show statistics. Sorry. What is the contact tracing module and what we do with it? The module allows us the decentralization monitoring, so we can, a lot of people in the city of Diamante and other cities that are surrounding Diamante, they can do the follow-up of this person at home with a cell phone. They call them, every register that data on the system at the central unit in the hospital, for example. We can all see that information. We also think we have to do this, the notification automatic, so we are working on that, do the notifiable disease form that sends the information automatically. Also, we generate the cases. We also can know about the risk factors and the chronic disease that the patient has, so we can have some alerts of them, geolocalization of them and their family. Also, we have the record of the callings and the monitoring of things and symptoms. We also incorporated the risk and statistics, this module, and because not all the people at the monitoring has the same rights or roles, we established two roles: the administrators and the callers. Here, we can see and register the callings that from the cases that we assign to them, but the case administration can see all the cases and all the records, all patients that are on the system. This is a screen of the module. I will see you now, show you how the module works. Here, for example, you may know it. We have a data tracing module that is an extension of one that Luis has done. So we have those things. Francisco. For example, here you can see this is a person they are monitoring. This data is a test data, so they are not patients. We have the person, the telephone number, the age. In this case, this person doesn't have a previous condition, but here we can see the family or the people that are roommates with this person. If this person has been COVID identified or not, for example, how is the context where the virus or the disease has happened. Also here have records or the callings. For example, in this case, status following up, the monitor could talk with the person. The person said he was good today and he was better than yesterday, and then ask them about the signs and symptoms. For example, here, if he has headache and other kind of questions. Yeah. Look for another one. In this case, for example, we have the domiciliary unit that is here, so we add it here. You can see where the people live, so we can add that to a map. We can find where the people are doing the isolation. Also, we added a lot of reports. And take it. And also here on the view, people have not been called yet, so we can, when we enter to this at this moment, if we have to call them or not. Also, if they have filled the criteria of the case, an alert. And also we have a lot of reports. Here you can see the discharge report, isolation report, contact tracing calls, and also the statistics, contact tracing statistics. I will show you the statistics on the presentation. Also here we have the form of notifiable diseases. that we complete, and we add cases from here. There will be lots, the forms that started with expected case, we register in the system, and then that is the personal information, the signs and symptoms of the person, if he has fever, the risk, for example, diabetes, if she or he smokes or not. Here we have the drug treatment. Also, when he started with the signs and symptoms of he or she traveled to another city where has a community transmission. And here we can register the contact of these persons. From this form, we can create the contact tracing forms. So here we assign, after creating them, here that will monitor these people. Okay. Okay, what we have done is we have to train and do a lot of meetings. Here we share the first results were people from the municipality of Oro Verde and Diamante. Here is Fiorella and me working on the system. Here we are at the hospital training on a Saturday morning. Also from around the city. This is in Valle Maria. This is a village near Diamante. This is Brasilera, another village. This is the struggle that is a neighborhood to Diamante. Also, we have been presenting the results and the work that we have been doing in other conferences. This was from the agencia, and this was from the Italian hospital. Here are some statistics that are real. This is real data. Here we have implemented the system on September. See how the register of cases increasing during the time. Oh, sorry. These are contact tracing. So, this is. We started with a few. During time, the increase in the data. Here we have the record for these are the notifiable diseases, these are the contact tracing norms. So here there are monitors that follow one or two cases, and there are other monitors that follow much more cases together. So we can see here that some have more callings than also on this graphic we can see the total amount of cases. There are the confirmed ones. This one of the suspected has got symptoms and signs, but they are not confirmed because they didn't do the lab. These are the suspected case contacts only that have got not signs. Also, here we can see the cases, the positive and the suspected ones from age, the range of ages. And here there are the cases. Okay, I want to thank from the opportunity of working, of course, in the engineering faculty, Fernando and the team, the study group on public health and applied technologies. Also for the authorities from the Municipality of Diamante and the San Jose Host. Least but not least important, the team of monitors. There are people that care for the people that are isolated, and it's a nice group. This is a work team. The project has a lot of people working, so I will show them. This is the operative team. This is Carly, me, Francisco, Ernesto, Maya. These are the authorities from the municipalities. Also, we have support staff, people here, and the investigation. Thank you very much for this opportunity, and I don't know if you have any questions.
Yeah, thank you very much. That was really...
That you have understand me.
It was a little bit choppy in between, but it worked, at least for me. Yeah, thank you very much. pretty interesting presentation, and I would like already to ask the first question. All the people that were already before that registered in the system, or was that also part of the contact tracing activity?
The people that we were tracing, yes, we have already working with the system work. But for this case, we made another database with new people and patients. So the records were all new. We didn't share the database.
Okay, basically when they come in either as contact or as sick individual.
Yeah.
All right. Okay. Next question. The signs and symptoms would be very interesting for research on infected persons. How do they cope with the disease? What are the problems they have after regeneration? Are you also collecting such data?
Yes, we collect signs and symptoms like sore throat, fever, headaches, and also heart rate, temperature, and other kind of things. We are working on an statistics on that and doing an investigation because people with diabetes, for example, have worsening more than other patients with no risk factors, for example. Okay. So we have to do an investigation about the relation of the signs and the diseases, and other diseases, not COVID.
Okay. In terms of managing the contacts and the calls, how many contacts per caller or monitoring agent can you manage with the solution?
The people that are monitoring here also have another work. So we assign them maximum 50 people for a caller because they are not only dedicated to do the monitoring, but that's it. We have a lot of callers, so we can distribute a lot of contacts and suspected cases or confirmed cases. I think 20 maybe monitors. So we have 15 per each. Do the math, something like that. And Fiorella, also he monitors a lot of people, sometimes 50.
Wow. Wow.
It's a lot of work.
Okay. Yeah, I can imagine. We have in Germany the discussion that the health authorities are not able to catch up with the contact tracing, basically. And I think above 50 basically stuck with that.
Yeah.
Yeah, thank you very much. We're pretty the next presentation. Thank you again. So we have now Denise Vinocura from Argentina as well, talking about GNU Health in the Nutrition, Endocrinology and Diabetes Department of the San Martin Hospital. So give me a second to make you presenter.
I think Denise isn't presenting. Denise won't be presenting. No, I think no. Fernando, earlier Fernando told me that Denise couldn't be here, but I don't know if that is confirmed or not.
Okay. Is Alberto then the presenter?
Do you think that it's Francisco was probably going to take over the Denise presentation? I'm not sure.
Maybe the presenter can step up. That would help us.
Yeah, it might have happened something to Denise. In any case, let's see. Let me talk to
I think
Fernando. He might have more information. If for whatever reason this talk cannot be done, we cannot change the schedule because some people might be waiting for other talks in the right timing or whatever.
Right.
but we can leave it for open discussion or go to the cafeteria or whatever. But
Right.
give me
Sorry?
5 minutes and
So
see
there was
what.
already someone there, Alberto, but he was only hearing.
Oh, but I think that Alberto, I think.
Okay.
All right.
Yeah, if Denise had some issues or couldn't make it for whatever reason, then my propose is we can leave this half an hour period either for open discussion, where Dr. Hagen Bichler will invite you to a beer or something.
Oh, really? Unfortunately.
No, but he has to pay.
Edgar, beam it over. Oh,
Just give me a couple of minutes and I'll try to get the status on whether Denise is not making it and whether Fran or somebody is taking over her
okay.
presentation, and I'll get back to you. In the meantime, there are so many open questions that we can actually address in this period, which is always great to have space for discussion.
Right, right. Yeah, I mean, it's first of all very good that this new contract tracing module is already heavily used, and my question would be, could this extension that you made to the contract tracing module, is it very specific to Argentina, or could it be included in the next release as well? Because what I've seen, so the general questions like are you coughing and something like that are generic enough to describe the health symptoms, and I think that could be useful if we implement that in the GNU Health Standard.
I am positive that